Hello, my name is Pamela Green, and I am one of the jurors in the case of the Hospital of Ashford Hospital with the plaintiff, Ashley Fuller. I am in favor of Ashley Fuller's case because the hospital did violate her privacy. As her being an employee there and also a patient, her information should have remained private as well as the other patients that was on the email distribution list that went to the entire hospital staff. The Ashford Hospital should be fully responsible for all necessary replications of what should have happened. They should also take more precaution on their procedures of getting the operating room schedule to the necessary people. The only persons that should have seen that email list was the providers and the staff members that will be involved in the treatment of the patients. Now, the hospital should review their policies and enforce a better method of getting the schedule out to the necessary operating room staff. Now, in Ashley's case, she will always be treated differently based on what has occurred, and that is definitely not fair to her, and she should not have to work in that type of environment with people knowing all her personal information. Personal information is just what it is. It is personal, and that's between the provider and the patient. Anyone who violates that should be reprimanded accordingly. It is not fair to the worker or the patient for information to be viewed and for them to be judged according to their medical background. The hospital should have policies in place for the necessary processes of getting data and personal information to the right sources by secured networks. And even though they have secured networks within the hospital, only personnel with certain access capabilities should be able to view that. Now, her personal information with Social Security number, medications, and treatment plans, that should only be viewed by the physicians and the persons treating her. Now, the other necessary staff, which may be involved in the cases, such as some of the nurses, may not have access to all of that. You have different levels of security clearance. And each person, when they access medical records, have different levels of access and different levels and privileges of things that should be seen by them about the patient. Now, Ashford Hospital should go back and review their policies on the submissions of operating room schedules. They should also provide proper training on to their personnel in reference to how to deal with an email that may have gotten out to the wrong persons. And they should also train their personnel as to when something like this happens, what to do and who to address it with. It should never be discussed amongst the employees, and when that person does return back to work, it should never be brought back up to the person that their information was viewed at the job. So there's a lot of training required at this particular facility in order to overcome the barriers of what has happened with the access of her personal information. And also, after training, they should have follow-up training as well in order to deal with and to avoid this reoccurring ever again in the future. Just because it happened to a worker, they should also be very cautious on other patients because that could have been a family member of another employee as well. All personnel health records are very private, and I really feel that this has been a terrible mistake, and the hospital should be responsible for handling that and making themselves appropriate to the employee and provide her with a better explanation and justification of what actions have occurred. Thank you.